will be no burials for the next 2 days, nor will bodies be collected from public or private hospitals or homes. Undertakers affiliated to the Unification Task Team have embarked on a national shutdown. They are pleading with government to listen to their concerns, and a meeting is expected later this week. Our reporter Linda Mnisi is in Johannesburg. Linda, a very good morning to you. The impact of this strike on families is detrimental. Exactly how severe is it?
Long-lasting effects of this strike is felt by those who have lost their loved ones. Just this morning, I was speaking to one of the leaders of the UTT, and he says he's actually feeling that a lot of their clients are suffering as a result of the strike. They've issued guidelines in terms of how to handle anyone who dies at home. You'll remember that what they said was that nobody will be picked up, or no body will be picked up at home if anyone dies or if any family member loses their lives. But as you can see behind me, they're back at it again. The coffin is still here outside the Chris Hani Baragwanath Hospital. They're calling for their demands to be heard. And when I engaged their leader, their national convener, early this morning, he did say that there was a bit of developments that happened last night, but would be able to share them with us at a later stage. So at this point, it seems as though the protest or the picket still continues until government engages them. Yesterday, we also had an opportunity, to speak to the National Department of Health, saying that in one of their demands, which is to, have government allocate land so that they can build cluster storage facilities, the National Department of Health saying that, well, they are not prohibited from doing that, and that the issue of the certificate of competence is not a prerequisite for anybody collecting a body at any hospital.
And what are some of the biggest concerns faced by the health department at this time?
Well, at this point, you'll remember that many of them are stationed outside these hospitals. So what they're battling with is really having families come in to just identify the bodies. They remain open. If someone dies at a hospital, they remain open. The mortuaries remain functional. But what can't happen is that families can't collect bodies, and that will result in the piling up of a number of bodies. We'll be speaking to the Department of Health later on and how they're managing that situation. Has been well over 24 hours since bodies have not been collected. Are they coping, given the fact that there could possibly be more people that have died overnight? And Paul?